Hi, my name is Donna Swanson. I'm the Executive Director at Focus Alternative Learning Center, an agency that works with individuals on the autism spectrum in Canton, and we also have 2 group homes. And our show is called Focus on Autism, and we are lucky enough to have parents that are willing to be on our show today. And we're going to continue some of the discussions that we had on a previous show. We have Sharon Cable, who is Alex's mom, and everybody remembers Alex, I'm sure, because he's usually one of the regulars here. And then we have John Lanoy, who is Dan's father. We've had Kim on, your wife, on before too. And we're going to continue our discussion on just what it's like to be a parent with children on the spectrum, and some of the tips that they have for making things work, and talking a little bit about just some of the feelings that go along with that, and some strategies and so forth and so on. I wanted to start with one of our parents, and I think it might even have been Kim, who said once you realize that these children are a blessing and not a problem, that it sort of changes the way that you feel and approach them, and they do bring so much to our lives. Now, I don't have anybody on the autism spectrum as a family member, but I absolutely love the children on the autism spectrum, and they are my passion in life, and I learn so much from them, and they're just such a gift. And I'm going to start with you, Sharon, because Alex, well, both your kids have been very, very challenging, as many of the kids on the spectrum are, but Alex has been, a pretty challenging kid right from day one on. And he's had, to look at him today and to see where he's at, it's hard for people to realize that some of the difficult things that you've had to deal with, like aggression and how he behaves out in public or in school. And I thought maybe that both of you guys could address some of those things, and how it feels when people don't understand you or your child.
Mm-hmm. I think for me personally, it's easier to explain the situation to people. Even now, when we're in public, I'll talk Alex through the situation and make it clear to people what we're doing. So when they overhear, and if he says something strange or does something strange, they understand that there's some kind of teaching going on and that I'm dealing with it and working with him. When he was younger, it was harder because his behavior was more difficult and he could be aggressive at times. And I think letting people know what was happening really helped me. I know a lot of parents don't feel that way, and they're uncomfortable saying my son has autism and he has a difficult time in this kind of situation. But for me personally, I think it's very helpful. And I'm lucky because my extended family knows Alex well, and they understand the autism spectrum. They've even gone to the Spectrum Unplugged panel and different conferences to learn more about it, and even read some books. So they understand Alex better, and it's a lot easier when we're in a family situation with the extended family, because they understand Alex and they realize that he's different and he needs some help in these situations, and they understand how difficult those family situations are for him. And I think a lot of people don't realize that. They think it's a relaxing, fun time. And for a kid on the spectrum, a birthday party or a family gathering like that can be one of the most difficult times of the day. And I think my family understands that, and it makes it a lot easier. And I try to be really open with people who are going to come in contact with Alex, so they understand what he's like and why he's doing the things he's doing.
Alex is very accepting of you explaining him, even right in front of him. He doesn't get upset about that at all.
I think it's because I've always done it. Since he was little, I've done that. And he sees that then people leave him alone and they don't bother him or say anything to him. And I think he sees that it works, so he accepts it, I think.
What things would make him aggressive? Because there were different times in his life where he's been pretty aggressive.
Yeah. When he was very young, it was just being frustrated. And in the beginning, he did the head banging, and then he kind of passed through that stage, and he did more of the head butting, which is back of the head, which is still serious, and he bit himself. He has gone through periods throughout the years where he's bitten his own arm, and he'll break the skin. I mean, he'll actually bite. He scratched himself. He will bite other people too. He's never bitten another child. It's always been the adult that's working with him, usually me, or he would come off the school bus be really frustrated and anxious and come at me before I even did anything with him. It was just like a release, I think. So,
and that's that brings me to something that you always say, is that you always assume that whatever behavior he's having comes out of his autism, so that you don't get upset, you don't take it out on him, even though it's frustrating. You look at it more as something to solve, rather than, you know, now look what he's done. That it's not directed at you. It's coming from his autism, because if it wasn't, he's not doing this on purpose.
Right. Exactly. Yeah.
And how did you come to that? That's a hard one for people sometimes.
I think because I could see that he could be a sweet, loving little boy, and then sometimes out of the blue he would just turn and bite me or pull my hair or hit me. And, you know, I could see that it wasn't something he thought about. He wasn't angry with me. So I knew that it had to be coming from some kind of sensory overload, or him feeling overwhelmed or frustrated, or something that was probably a result of his autism. So I always try to look back and say, okay, what happened here? Look back. And it's not as simple as, oh, somebody just hit him, so he's hitting back. You have to sometimes go back and say, okay, all day he's had to hold this in, and now he's just exploding. He didn't have enough sensory breaks throughout the day. He didn't have enough physical activity, for whatever reason, and I try to solve that puzzle and see that that doesn't happen again.
And his sensory needs have changed over the years, and that's important too. I mean, sometimes you've done the brushing. His sensory diet has changed, so to speak.
Yeah, that's something you have to constantly be looking at and kind of reevaluating what things are working, what things are not working. He's old enough now that he's actually able to tell me, Mom, can you brush my hands, or I'm going to need something to chew on here. Or something like that if he's in a difficult situation. But that's only been really the last couple years.
Right.
And even now, he cannot do it all the time. I'll often say, I think you need a piece of gum, or do you think you need some popcorn? And he'll take it. Sometimes I have to suggest it, though, before he can think of it.
What about Dan? He's had, you know, the sensory issues. He's been aggressive.
When he was younger, he did the headbutting, and which was really hard to watch. And you know, obviously you would stop it, but to see him so unable to communicate. When he was a little older, when he would try to play with a kid, he'd push him, and then he'd get yelled at for hitting. But he wasn't able to communicate. As he's gotten older, you know, when he was 8, 9, he got physical because he was just so frustrated. He was aware he was different. He was frustrated by it, and he knew that everyone else knew it as well. And as he's gotten older, as you know, he's got involved in focus and kind of found his way, because for Daniel, part of the problem is he doesn't really know where his path is going to go, and so it kind of made him a little helpless for a while when he was probably like around 11. But since he's gotten re-engaged with focus and that, he's much better. And he is able to communicate as he's gotten older, which makes it a lot easier about his feelings. But it's still very difficult.
And his getting used to focus was not easy.
No.
That he was terrified at first.
My wife would drop him off and he'd run right back out. It was a very hard transition. He's always had difficult transitions, even when we put him tried to preschool, or it's just he's very regimented. So for each person he meets, he has certain rules. And so for my brother can get away with certain things with him, because my brother's kind of wild and crazy uncle, but he won't allow other people to do it. So for everybody, he has certain rules. So he'll hug certain people, he'll kiss certain people, he'll shake certain people's hands, and he'll speak to certain people. And so everybody's got rules. Somehow in his head he's got rules for everybody. So we're working with him to try to, now he'll shake hands, you know, at church for strangers, and so as he's getting older, he's getting a little better. But it's very hard because as he's grown up, he wanted a strict schedule. And I think with a new diagnosis, and as your children get older, they want a schedule. And if anything happens, like life, that messes up the schedule, you can have events that throw them off into whatever misbehaviors or bad behaviors or behaviors you don't like
Right.
to occur.
And again, schedules are important. It's important to know what schedule works for your kid. And sometimes some kids like to know in advance. Some kids you can't tell too far in advance because then the anxiety is too much. So it all comes down to knowing your child. And you hit on something that I think is really important, when that's relationships and their own set of rules. I know Alex has a ton of rules that he lives by, and Dan too. So they define certain relationships and certain situations, and things need to happen in a certain way. That's how they organize themselves. That's how they manage their anxiety. For Alex, he's got a whole life plan, and he also, when adolescence hit, he put himself on that 1,000-day plan so that he would keep his hands and his lips to himself. That kind of kept him out of trouble. Those days are almost over.
172 days to go.
He's got 172 days to go out of that 1,000. But so I find that fascinating about Dan. I did not know that he had different rules for different situations.
It's not necessarily he'll say it, but
Yeah.
I've seen it.
Yeah.
And it's how he can control all the stimulus that comes through. If you can only imagine being on the spectrum and having, like we talked in the previous episode, all these stimuli, and you're trying to control it, and then you have someone you have to talk to and look at, which a lot of kids can't do both. So he creates these rules in a world with no rules, or unspoken rules that he doesn't know. So he creates his own rules to create these socially accepted relationships, so he can then control it and feel comfortable. You know what I mean? As long as he can control it and the rules, he stays within the rules, he's comfortable.
Now, when he did his first panel, because he's done so many TV shows, I didn't realize it was his first panel, and afterwards he said, "Whew, I did all right. That was my first panel." I had no idea, because he does such a good job here on the TV show, that I didn't realize that was his first panel. But he really trusted us and the group, and he just sort of gave, and Kim was there as well. So I think, and the grandfather was there too.
Yep.
So he just trusted us to get him through it, and I didn't even realize that that it was his first time. So relationships are so important. Do you ever feel embarrassed of their behavior? Because I know some people do, more that other people don't understand.
I do a little bit, particularly because he's now like 5'10", and he's clearly a teenager, and people can see that he's a teenager, and he'll often say things that other people might be feeling, particularly like in church when it's quiet, and he'll turn and say, "Is he ever going to stop talking?" And usually you'll hear a little giggling around, and I'm a little bit embarrassed, but the people are used to him and they know it's Alex. And he'll hear a baby and he'll go, "Is that a baby over there? Did you hear a baby?" And he wants to see the baby because he loves babies. But he will, sometimes say things that are a little bit embarrassing, and I'll usually hold up a paper and a pad and a pencil and say, "If you need to talk now, write it down," and he'll write his question or whatever.
How about you and Kim?
Well, for Dan doesn't have extreme behaviors. So for the most part, when he was younger, he used to do meltdowns, which are difficult, and it's hard when you're like in play groups, or it's hard to try to explain, but you love the child. So in a way, they'll just have to deal with it. You know what I mean? You just love your child and take care of your child, and then try to explain and educate as best you can. But you can only do so much as a parent. And I don't feel embarrassed by him for the most part. He does say things sometimes that I cringe at, and he's 16 now, so he's a teenager. So not only is he on the spectrum, but he's an adolescent. And as any parent would know, adolescents can say a lot of things.
That's right.
And you're not always comfortable dealing with them.
And as much as I love their honesty, because I don't read cues very well, so I always know what they're talking about, because they always tell you exactly. But their minds are fascinating, and the things that they think of and the things that they have to say. But it does get them in trouble. One of our kids told their one of this a lady that came into focus, she was well over 300 pounds, and he said to her, he goes, "My, you're a big one," and she was kind of embarrassed, and I talked to him and I said, "I think you might have hurt her feelings." And he went in and he apologized. He said, "You know, I'm really sorry by what I said," but he said, "You got to admit, you are kind of on the big side." And actually it was an improvement for him, because he noticed her and he also noticed what size she was. But then trying to work with him on the filters, and she was really good about it. But you know, people, they do say what's on their mind. Like, "I don't want to work with you because you have coffee breath," or something. They're not insulting you, they're just telling you the truth.
Yeah. Alex said that about his grandparents. He said, "Boy, you guys are really old." And they're 97 and 100, so they were actually pretty old, but that's not the way you usually would say it.
But you don't make excuses for your kids, because you love them and you accept them, and what you're hoping is that other people will get beyond the behaviors and appreciate all that they do bring into the world. And we talked a little bit before about that there is kind of a grieving process that is, even though you have relief over the diagnosis, there are things that you look at that they're not going to be able to do, or their life is going to be different than from other kids. Can you give an example?
Well, I mean, from a dad's perspective, you know, Daniel has trouble with coordination. So when he was younger, you know, we couldn't play catch.
Yep.
It was very frustrating for him, so he wouldn't do it. And if Daniel doesn't do something well the first time, he won't try it. Mm-hmm. So he didn't ride a bike until he could ride a bike.
Right.
He wouldn't, you know, we didn't play catch until he could catch the ball.
Right.
You know what I mean? So it was a lot longer. So the, you know, grieving process is managing your expectations. And, you know, a lot of it is through my own selfish expectations as a father. And so you just have to, you know, really, and part of what Daniel's gifts are is in any child is really look inward and say, really, why is that important to me? And really look at, really, what is he giving me in turn? Mm-hmm. And, you know, we do other things that, you know, make up for it. So it's just a matter of transitioning, that's all. Mm-hmm.
And I think that's good advice for all parents, is to be able to accept your kid. You know, maybe you wanted a baseball player, but your kid was more into ballet, or, you know, I mean, whatever they're interested in, their art or their, you know, it's okay to have, you know, let your child have their dreams and encourage their dreams.
Absolutely.
Now, Alex wants to be he only wants to be a minor rock star. He doesn't want to be a major one because it's too much pressure.
Yeah, he wants to be able to have his privacy, too.
He wants his privacy.
Still do that. But yeah, I mean, there's some things you expect your child is going to do, say, by 16, and then you just have to kind of rethink that and think, okay, what does he want to do? What's important to him? What can I help him achieve or, you know, learn so that he'll be happy? And what are his goals? So it is a little different.
And we're going to talk more when on another show with when we have the regular group on, but they all grow at different rates. And for people that know Andy, Andy does not want to go out and have his own place to live at this time in his life. However, Andy did want to get a driver's license, and then there are others who don't want to get a driver's license but do want to go out and have their own place to live. So everybody has we all march to different drummers, and especially our guys, they have their own way to grow, and you can't push them into anything. That I've learned over the years is that, you know, we do gentle nudging, challenge by choice, but if they don't want to do something, I listen to that, because when they say no, they mean it. And it's not, I've been often told that our kids are oppositional defiant, but it's not oppositional defiant, it's what their comfort zone is. And until they're ready to leave their comfort zone, they're not leaving it. And one thing that you said that made me think of is they are very much perfectionists, and they really need to feel like they're going to succeed, otherwise the risk is too great to take the chance. And they are very hard on themselves too.
He is very hard on himself. And I'll just go back to one of the things, though, for oppositional defiance is we also do expect Daniel to do certain things. Mm-hmm. he has chores, and we have his curriculum. We homeschool, so we have his curriculum. But one of the things is determining what the curriculum is based on where you expect him to go. And we never expected him to go to college. Now he's starting to talk about it. You know, those kinds of things. So it's really interesting how they can
lead
evolve.
you.
They lead you.
And
you just have to follow.
if you're listening, the journey's quite interesting.
Right, absolutely.
And Alex has led you where?
Where? Well, he has, as you know, a long list of things he wants to do. He was looking at careers for school, and I saw him on the computer looking up taxidermist and mortician. And I said, do you know what those are? And he actually did. He said, Mom, I'm just finding out what jobs are out there so I know what's out there. I'm like, okay. He said, and I have to know, you know, if I need a degree, if I need to go to college, or what kind of school I need to go to. So he was actually looking up the schools to see where he would go and, you know, how many years he would have to study to have that job.
And some of the kids may only take one course at a time, or, you know, they may take a longer time to get through high school. It's really, everybody has their own pace, and the social relationships are very hard for them. And I think that's something that Focus does a nice job with, is providing a peer group for them that, like Alex will always say, they understand me and like me just the way I am, and I like them just the way they are too.
Yeah.
So that for Dan, when he was having a hard time coming, nobody ever judged him for that. They were just, every time he came, they were happy. And same with Alex. You know, he's having a cranky day. People understand that.
And it was really nice. I think it was perhaps on one of the other shows that Dan was saying that he understood Alex, and when he's over at the house with Alex, if Alex is having a hard time, he gives him a little space, and then he comes back and they start playing again or doing something again. So he knows that, you know, I think Alex is having a hard time. I better give him a little bit of space, and then we'll get back together again.
Because sometimes Alex just leaves the play group, or what, you don't want to call it play group, but the social setting, because it's too much for him at the time. And
when he's ready, he'll walk around a little, and then when he's ready, he'll kind of come back and just rejoin.
Right, Daniel just
and
says,
the other
that's
kids
Alex.
are like, yeah, exactly.
That's Alex.
That's Alex.
So Alex will come back. He'll come back. And that's the wonderful thing, is the kids basically give each other the room and the respect to come back and forth and not judge. Because that's so hard in relationships, not to judge the other person, as if their behavior has something to do with what I did. You know, that it's a bad reflection on me. Maybe it has nothing to do with you, and it's what they're, and obviously most of the time it's what they're dealing with.
And I really think that and that's, our kids say that all the time. They want to be understood. They want to be met halfway. They don't want to be changed, because they don't feel like they're broken. They feel that, you know, that they're fine the way they are, but they feel like they're square pegs in a round hole, and they would like the world to offer them a square hole to be part of. And they are very, very fascinating, and their interests are fascinating. I was in a store, I won't name the store, but Alex happened to come into the store, and first of all, he was stunned that Fred, my husband, and I were there, and then he thought for a while, he circled us for a while, and then he came up to me, because Alex is very interested in animals right now, and he asked us if we thought it was a bad thing to have sharks in the pool. And I said, he said, I think we might need a rule for that. And I said, well, we already have one. It's called safety. And he goes, okay. But he has these random things that he'll come up to you and just and ask you about. So and their minds are they're always thinking. They're always thinking. I'm thinking that we have like about 1 minute left. 5 minutes left. Okay. So we're very relaxed here, and I have trouble with time. What would we like to do with our last 5 minutes? What really important messages would we like to get out to the parents? Because it's just so good to have both of you here.
Well, I'd say maybe look at your child and see where they're at, and try to start at their level and see what interests them. Maybe you can use that to help develop some skills. Kind of take their lead and see what direction they're going and where their interests are, and see if you can build on that.
So if they want peanut butter every day for 3 years,
Go with it.
Go with it, right?
Have some peanut butter. Keep introducing the other things, but go ahead and put the peanut butter and jelly or whatever it is they want in there, and just keep, you know, introducing things and hoping that one day they'll try it. And we did that year after year with Alex, and all of a sudden he started trying things. And now he's surprised. He says sometimes he turns it down. And the other day we went to a restaurant. He ordered a fish sandwich. He's never eaten a sandwich, and for one thing, and he didn't eat fish, and I thought that was a little bit odd. But he ate it, and he said he liked it. So, you know, you never know. If you keep introducing things, all of a sudden one day they try it. And you get a surprise.
And one of the things that you both say is that you need to modify the environment as for their needs and as their needs change. There was a time where Alex didn't like any kind of smells, so you did your cooking before he came home from school.
Things like the blender, the vacuum cleaner, hair dryer, we just didn't use them. If he was in the house, we didn't use them. Smells, yeah, we just were really careful about that. And we keep the house relatively quiet and relatively kind of sparsely decorated, I guess is what you'd say. The walls aren't filled with a lot of things. There's not a lot of clutter on tables and stuff. There's a lot of space for him to maneuver around furniture. So we keep it kind of as simple as possible for him, quiet.
What about you?
Well, a number of our picture frames are scratched or dented because as he's walking down the hallway, he'll bump into them. So, we have lots of pets. He loves animals, so we have 3 dogs and 5 cats and birds and rabbits and the whole thing. And he loves that. He's really, I think it provides him that contact without talking.
It's that unconditional positive regard that your pets love you no matter what.
Right. And that he can control the relationship. So it's like, you know, and I would just say, because I know we're running out of time, that if you're newly diagnosed, you know, if you have a new diagnosis, that you you should make sure that both parents are involved. Be patient, but also it can be very burdensome on one parent, usually the mom, to be overloaded, and to make sure that dads step up and get involved, and don't be afraid to get involved.
I think that's an excellent point. And one of the statistics that has just come out that's very sad is that the divorce rate for people on this with children on the spectrum is 80%, greater than 80%. And I have to say that it's wonderful when you see families that are able to stay together and be able to come together and understand and work together, because that is the best scenario. That's the best scenario for everybody. But raising somebody all by yourself is very hard. And to have good family values and keep things simple, we like that. At Focus, we have 6 rules. That's it, and they work for everybody. I guess our time is up, and again, I can't thank you enough for being here.
Thank you.
Sharon, thank you for letting me drag you everywhere. And we hope you stay tuned, because we have a lot more episodes to enlighten you with and show you the beauty of our children and their families. So thank you very much, and see you next time.